There's no way we'll reach our greatest good.
Greetings, Manchester. You're in tune to the search engine. Legacy 90.1. Big shout goes out as always to the one and only DJ Lighter. Doban Jungle, Doban Jungle. Moving swiftly on with the time changes. Doesn't leave us a lot of time to get into discussion. We want to get into some discussion this evening. And as always, your views and opinions are welcome, needed, and much appreciated. And the text line number is 075-9964-2626. And you can also join us this evening online. So if you want to see us, you can go on the Legacy 90.1 Facebook page. And you can also go on YouTube on the SEUK Global. If you put that in, then that'll bring you to the page, and you can also see us there. And you can get involved there too. You can give us messages there and get involved with the show. And the show for this evening, we're going to be talking to CAHN, Caribbean African Health Network. It's been a while since they've been on the show. They used to be a bit of a regular when they first started. They've been doing loads of work. Caribbean African Health Network speaks for itself. They're dealing with health, many issues that they deal with around Black health, and bringing people together, conferences, galas, events where different speakers that are expert in their field on health. And this evening we're going to be speaking with Elizabeth Alogba. She's a communications and events officer for CAHN. She manages all the communications on the social networks and many of CAHN's activities on health, heart, and other events. And she puts everything that goes up on their social media sites. And she also manages a team of volunteers. Also, we're going to be speaking to Charles Kwaku-Odoi, and I don't know if I pronounced that right, but I'm sure Charles will put me right once he's able to join us. And Charles is the chief officer of CAHN. He manages CAHN staff and volunteers, makes sure deadlines are met on time and things go according to plan. Chairs various CAHN's meetings and sits on various other boards, and is involved in many other projects such as CAISO, organ donation, cancer, domestic violence, domestic and sexual violence, and community engagement work, bereavement and mental health, of which obviously health and care covers so much of those areas. You know, you look at us as a body and you think, we're a small body, but when you look at the internal infrastructure, even your finger or your nail, there's like a whole department just based on that in a health. It kind of like highlights some of the issues and makes it more important why such organizations like CAHN should be about to clarify so much of these medical situations that many of us are not aware of or don't have the confidence to speak with our doctors or other people. We're also going to be joined by Sandy Koujou, and again, I'll have to get Sandy to pronounce her surname. She's a community engagement lead and francophone. And again, she's a community engagement lead. She's engaged in reaching out to the French-speaking communities in Greater Manchester with the purpose of understanding their needs and breaking the language barrier, and offering via CAHN tailored support. She's also part of the raising awareness around domestic violence issues within the African and Caribbean communities, and is also the domestic and sexual violence lead. CAHN is a non-profit organization whose purpose is to empower, enable, and equip faith and community organizations with infrastructure to deliver and shape health and well-being services. They work collaboratively with commissioners, statutory organizations, and voluntary sector organizations with a particular emphasis on sustaining health and well-being in the provision within the African and Caribbean community. And what a time at the moment to talk about this, especially with all the COVID issues that have been taking place. And let me bring my guests in and say hello. And here we go. Hi, Sandy, how are you doing? Hi, Elizabeth. Hold on, let me get you up. Hi. Oh, what's happening there? I was hearing you before very, very well, weren't I? So what's happened now?
Oh, hi. Yeah. Hi.
Oh, there you go. It was you. You were muted. And so, Sandy, can you hear me okay?
Yeah, I can hear you fine.
Oh, brilliant, brilliant, brilliant. So we're still waiting on Charles to join us, yeah? So obviously he's trying to make an entrance, isn't he? so we'll allow him that, because we know he'll bring it when he comes. So if you are there, Charles, and listening, so when you're ready, just get involved. So let me say hello to you two. Actually, let me start with Elizabeth. Yeah, Elizabeth, just tell us a bit about yourself and your role with CAHN, please.
Okay, well, thank you so much. I just have to say thank you so much for having us. I know it's quite late, but thank you for having us.
You know what? Late, but this is the time of my show. I don't know. I've been doing this time for a very long time.
Yeah. A little bit about me. Hi everyone, I'm Elizabeth. Based here in the lovely city of Manchester. My role here at CAHN is the communications and events officer. So you're probably wondering what that involves. And it's all things comms. So that's from managing, the websites, making sure our information is updated on there, from our social media, making sure we're engaging with, our different audiences on our social media platforms, making sure we're pushing out all the different projects CAHN has going on at the moment, but at the same time engaging with our different partners, our different other organizations as well. One thing we're really big on here at CAHN is collaboration, really connecting with other organizations and seeing what else other people are doing and just supporting them during this time. And then also the event side, I call it the best of both worlds, because it's like I love both sides of it, but the event side is all the activities that we actually do here at CAHN, and obviously during COVID we've had to adapt and actually do a lot more virtual than physical events. So that's all things from the planning stages and then following it through to the final and finishing products. So that's my role.
And because I know for me, I find social media a challenge, to keep up with. It's constantly changing, and I know people who are aware of it, they know how to link certain things and pages and get them all on the same page at the same time and whatever. So is your phone just stuck to you, or your computer just stuck to you?
I actually have two phones. I actually have a work phone where I manage all of CAHN's socials, and then my own personal phone where I'm actually managing my own.
Okay.
And I do agree with what you're saying. Social media, it's a roller coaster. Early lockdown, I had to be very wary of what type of news I was taking in, just because there's so much going on in one go on social media. So you do have to be very alert, because the news is always changing. Different things are always changing, different trends are always coming out, and you do have to be on top of it. So I would say with social media it is a lot to keep up to, but if you're a skilled person, it shouldn't really
well done. So that if you don't praise yourself, people are not going to do that. So keep patting yourself on the back, keep doing that. And Sandy, thank you for joining us. Tell us a bit about yourself. Well, first, before you start, yeah, and please, you have to bear with me because things generate around my cranium quite slowly, yeah. So, what's a francophone? I've heard the word before, but I don't. I'm
Yeah,
not saying
okay.
that if I don't know it, other people are not going to know, but the chances are. So yeah. So your position is community engagement lead, and then it's got francophone. Please explain.
Yeah, that's a good question, Anthony. And again, thank you for inviting us. It's amazing to be here. It's a good question actually, because some people will say that if you're coming from the French African country, you know, some people will think that they'll say you're French, but you're not French. You're a
Okay.
francophone speaker, because if you say
Right.
French, it usually refers to French from France, but we're not French from France, or it's not, you know, it's the same French, but it's just that francophone covers all the French speakers from Africa or all around the world. Because in Canada, you speak French as well, but you know, you'll say the francophone speakers of Canada because they
Yeah.
speak French and English. So yeah, in a nutshell, that's what it is.
Okay. And it's obviously. I mean, it's amazing. I mean, I wish I could speak other languages. You know, I try and I make up my own languages. You know, which nobody else understands. So they can't tell me that I'm wrong. But yeah, I think well, it opens a whole of new other world, doesn't it?
Yeah, it does actually, because yeah, you rightly you rightfully mentioned beginning. I'm the community engagement lead for the Francophone community in Manchester. There's a massive community, African community. I mean, not just African. You have French from other parts of the world living. I mean, French speakers from other part of the world living in Manchester, and yeah, you need to connect, or we need to connect with them. Sometimes their English is not really good. They need to have access to information. Unfortunately, during this COVID period, you know, we did realize that there was a gap somewhere where some communities were not getting the information they were meant to receive because of the language barrier. I mean, I myself, I have a background. I'm a translator, a certified translator by profession. So I speak French and Spanish as well. So
Okay.
yeah, so it's just
Wow.
good to have, yeah, it's just good to have this link between you know, the local government really
Mm.
and the French communities, because then at CAHN we make sure that they receive the relevant information. They receive some information needs translated into their language, which again, especially emergency information, because if you think about it, if you're in an emergency situation and the information is passed on to you into another language, you might not react as quickly as someone else would, you know, in the original language, because
Yeah.
they don't grasp the you know, the meaning of what that emergency message is supposed to be. So yeah.
Brilliant. Okay, well, we're going to go more into that. I'm going to go for a break, and hopefully by then we'll be able to also link with Charles. So thank you for that introduction, ladies. So listeners, we'll be right back, and we shall be joined by Charles at that time. We'll be right back.
Feel the vibe on Legacy.
If you have an upcoming event, a project happening, or an important announcement you'd like the community to be aware of, Legacy 90.1 FM are able to.
Charles is actually with us, but I don't know if one of you could send him a text, because he hasn't connected his device. He hasn't signed in and clicked that his mic and can be used, and unless he does that, then he can't get into the waiting room. So I'm gonna yeah, he has to connect his mic and his cam to get into the room. You just let him know.
Caribbean. Join us at Island Vibe in Cholton for the perfect authentic Caribbean meal with a true island feel, sweet reggae music and our wide selection of rum cocktails and wines. Island Vibe is the perfect spot for any occasion. Visit us for brunch, lunch or dinner from 12 p.m. to midnight weekdays and enjoy late nights and live music on the weekends. Vegan and vegetarian options available. Island Vibe for the perfect authentic Caribbean meal. 414 to 416 Wilbraham Road, Chilton, Manchester, M210SD. Call 0161 282 6061 to book now or book online at www.islandvibebarandrestaurant.com.
Blacker Group is one of the UK's leading sound, lighting, audio-visual and stage installation companies. Our sound, lighting, AV and stage installations can be found at venues ranging from exclusive restaurants to government institutions and corporate facilities. At Blacker Group, we offer an unrivaled level of service. Our experienced engineers only use the very best equipment tailored to your specific needs. And the service doesn't stop there. Our 24/7 maintenance team are on hand just in case anything goes wrong. So, if you're considering a new installation or have any sound or AV problems at your venue, contact the Blacker Group today on 0161 477 9300 or visit us online at blackergroup.com.
Legacy 95.1.
Hello and welcome back. You're in tune to the search engine with Anthony, and I'm currently talking. Well, today I'm going to be talking with members of CAHN. Currently speaking with Elizabeth and Sandy. We are trying to get in contact with Charles. You need to connect your mic and cam, Charles. See, when you're doing these things live, mic and cam, you see what people have to do. This work, you know what? Sorry, you know what I mean, don't you, Elizabeth? You're doing all these things at the same time. Okay. See, this, I told you we'd make an entrance, so we've got him here now.
Fashionably late.
You've made it. There you go. How are you doing, Charles?
Yeah, I'm good. I'm good, thanks. And you?
Just before we start, I did say your name before, Charles Kwaku. I said Odoi.
Correct, for 100 points.
Oh, wow. You know what? And that's probably a first for me. I usually don't get the name correct until about 2 minutes before the end of the show. So that's done well. So, okay, just before the break, Elizabeth and Sandy gave us an introduction of themselves and their roles within CAHN. I read out your introduction as the chief officer and somebody who oversees the staff and, you know, making sure that the organization runs smooth as it should do. Can you just tell us a bit about your role a bit more and actually give us a bit of a background as to the genesis of CAHN, you know, why it started, what was its ESP? Because, you know, with when you start a new organization, you usually say, where do I fit, kind of thing. Why are we doing this? Is there a need for us? Yeah. So could you just give us a bit of that, Charles, please?
Yes, thanks, Anthony, for the opportunity, and really delighted to be here with Elizabeth and Sandy. So CAHN started just over 3 years ago on the back of our chair, Bruce's PhD, looking at cardiovascular diseases within the Caribbean and African community and why Black people tend to have poorer outcomes when it comes to CVD-related conditions, so stroke, diabetes, and others. So during her community consultation, members of of our community were asking what she was going to do with the data and all the feedback they were giving her. And Faye did promise that her research wouldn't sit on the shelf, but she would do something with it. But then the more focus group sessions he had, the louder the calls were. So 10 people came together, decided to set up as a CIC. So that was back in 2017. And 3 years down the line, we're still here, going stronger and stronger. And my role, I've been, I used to be Director of Strategic Partnerships, and, I've been privileged to have been part of the journey of CAHN right from the beginning. And at this point in time, my responsibility is making sure that we solve and making sure that I'm working with fellow directors to ensure that we're fulfilling our objectives as an organization. So at the moment, our vision as CAHN is to end health inequalities for the Caribbean and African community within a generation. We know that's a mammoth, that's an ambitious task, and we really rising up to the challenge. And the mission of the organization is to engage in those strategic conversations on behalf of our community. So we become the bridge, and trying to challenge the myths around how to reach communities. And that's what we've been aiming to do, and thankfully do the last 3 years.
Excellent. Frank, thank you. Frank, what was that? I think sometimes you have to mute or you get feedback. Yeah, I think that's better. Thanks for that, Charles. So just a bit about your role then, Charles, and what kind of pressure you're under. Well, come on. When I read that, that's a weight. Not a weight, because I think sometimes it's how you carry things. That makes it heavy. But when it's like I was saying to Elizabeth before, that it's sometimes you have to pat yourself on the back, because sometimes not everybody's not going to come forward and tell you the good things that you're doing. But at the same time, some people also might see the weight that you carry and what you think. So you've got to be careful. So when I read your roles, the weighty roles, and you're working for a health organization, so you must have some secrets going on there, what we all need to know. So how are you dealing with all what you carry?
Thanks, Anthony. I think two things. I'm really pleased to have a team of directors who are really supportive, but very importantly, our chair, Faye Bruce, who gives so much time to make sure that she's checking things over, because we all need to be accountable one to another. And I'm then really grateful for the staff team, who rose up to the challenge during the pandemic, and no one said they were part-timers, but everyone is risen to the challenge. And I'm incredibly proud of the staff team that I had. At the start of the pandemic, we had 3 members of staff. At the moment, we have 9. We have another 4, sessional counselors. So the team has grown, but it's grown because we're responding to, the crisis. We're responding to the needs of our community. So I'm really grateful for the staff team, grateful for the counselors. So all our counselors are Black counselors. They gave their time at the point where we didn't have money. We told them we can only afford a month of their wages, and yes, still, they rose up to the challenge. They gave time. They were part of developing the service right from the scratch, and I'm incredibly proud of them. But my staff team, is just recently that the first person who started has become a full-time staff. But everybody gives their time and they go over and above, and I can't thank them enough.
Okay, excellent. Thank you very much for that. So let's start with engagement, because I think that's one thing that goes right through all of your roles. It's all in the explanation of your titles, And I know you've been having some, because I think it'll probably link in a bit with everything, with the COVID, with the issues that's going on in the community. You've been doing some community engagement meetings. I think I seen a flyer just as before I came out that's been taking place every 2 weeks.
So I mean, what we felt would be good was, prior to the pandemic, because of our capacity, we were having lots of conversations with decision makers. And like I said, in our mission, we're very clear. CAHN will not seek to take over another service being delivered by any Black-led organization. We will seek to complement, but also what our USP and our niches, to be able to have those strategic engagements. And at the start of the pandemic, we thought it would be good to bring our community together so that whatever we're doing, whatever conversations we're having on behalf of the community, we know that we have the authentic mandate of the community. and not just going to places talking on behalf of the community when we're not in touch with the grassroots. So that's one of the big things about CAHN. Yes, we'll sit with all the civic leaders, but we also make sure we're in touch with the grassroots, we're in touch with our people, we know, what they feel, the pain they go through and all that. So we thought it would be good to bring the community together. And, some of the things we do, it's a community who tells us. So people were ringing Faye, our chair, saying, what is CAHN doing? The pandemic is here. All the myths around 5G, this doesn't affect Black people. What is CAHN doing as a health organization? So we decided to hold the first Zoom meeting. And ever since, we've been having it on a fortnightly basis. And what that does is bring, senior leaders. It brings out some of the good stories, of service and sacrifice from people within our community who are running organizations who are doing some amazing stuff, but they don't have the platform to shout about it. We bring those together, as well as our civic leaders, including the mayor and others, to really engage with the community and answer concerns and queries, and the collective community response meeting. And so if you look at the names of all the services and activities we run, we make sure it says, what it is what it says on the tin. So the fortnightly meetings are collective community response meetings. And one of the key things I must say we've been able to do with that is to bring some senior leaders within, Manchester Foundation Trust, so which is Manchester Royal Infirmary, the Children's Hospital, to engage with our community, because for many, many years, people within the Black community have been fearful of going into hospitals. So we've been able to bring some of the senior leaders over there to answer questions to our community.
So is this like, when you say, is this like an open forum? Is it or is it?
It's an open forum for members of our community. I do my best to moderate it, and but I must say that the community has been responsive. People ask valid questions. People are mindful of their language. So it's adults coming together, having adults conversations.
Oh, excellent. And are you involved in these things, Elizabeth and Sandy?
Definitely, I definitely mind the chat box with all the different questions that people ask. But like Charles mentioned, it's always a success. We always have, as Charles mentioned, in the past, we've had Andy Burnham and some of his team actually come and talk to us as well. Like Charles mentioned, we always open it out to people in our community to shed light on the successes. A lot of people have set up different services during COVID, and we highlight that, and we actually acknowledge that and commend them. So it has been a success, and we enjoy the sessions. And people, we always open it out to people, definitely to come and join, so people can register if they'd like to join the meetings.
Excellent. So are you doing any interpretation while this meeting is going on, Sandy? Are you, bringing in the French speakers or the Spanish speakers and making sure they're involved?
Well, I wish, but not at this meeting. No, there are not many Francophone people involved in the meeting, but I do attend the meetings. Elizabeth mentioned earlier that at CAHN, collaboration is very important. So at times, if Elizabeth needs me, Elizabeth is very hands-on because she's the head of communication and everything. If she needs me, then I'll pop in. But even if she doesn't, at least, we need to show support to each other. So yeah, I will attend. I attend every event. If there's any updates in terms of community engagement for the Francophone community or the domestic and sexual violence project, then I'll provide an update. Yeah.
Because these meetings have been going on for a while now, Charles, and I would think. Sorry, these meetings have been going on for a while, so I would, and like you say, it's a very I don't even know how to describe this time that we're going through at the moment. But let me just use the word heightened. Yeah, it's just a heightened time. Everything's at the surface of people. Views of he said the fears about going to hospital, the whether you want to call it or not, the conspiracies around the Black deaths due to COVID, the response to that report, which they didn't want to publish initially, which again only heightens again mistrust in that type of way. We had the deaths in the community, which obviously it's life, so that's part of health as well. I don't know if there is any part of health where you say no, well, that's not our area, or is it, you know, from the cradle to the grave? Because I know you deal with pregnant mothers, you know. Is it also the same other side as well? I think I did come to one of those meetings, Charles, initially, and I think there was about 80 odd people there. Yeah.
Yeah, I mean, we've had some significant numbers. So I think the first time Ame and Benham came on there, you know, we had over 110 people also. So the numbers, you know, increase depending on, you know, what the subjects are. But we've had the mayor on there twice. We've had some of the senior system leaders when it comes to health on there. So Warren Hepler, for example. We've had the GM lead for population health, so the director of public health for, you know, Wigan. She's been on there about 2-3 times. We've had a DPH also, you know, from Salford. So anything that concerns our community. So whether it's even explaining why people should put on masks, why Black people need to look after themselves a lot more. You know, we've dealt with all those things. And, you know, when I mentioned earlier on, you know, the fantastic response of the directors and the team, you know, apologies, I didn't mention our volunteers, but as you know, volunteers like face-to-face stuff. But even with these events and the online stuff we've done, you know, some of them have said, what can I do? You know, and for some, they find real fulfillment, even if it's just to mute mics and let people into meetings and throw people out when they are distracting, you know, our meetings. So, you know, it's been amazing. And, you know, it's been incredibly busy times because we are a Greater Manchester wide organization, we've been having lots of conversations, you know, around test and trace. You know, the system knows that Black people don't trust them when it comes to vaccines and stuff, you know, and we've been having conversations. How do we help our partners to rebuild trust? And you know, maybe Sandy might not have mentioned it, but you know, she's had to lead on doing translation of public health message into Portuguese, into, you know, French, so that we can share that with, you know, our African brothers and sisters. But also, you mentioned the Public Health England report. I'm not sure many people know, but we commissioned our own research into the impact of COVID on the Caribbean and African community. And till this point, I haven't seen anything like that up and down the country. You know, we engage at national level as well. We fed into the report led by Professor Kevin Fenton. You know, we published our report the day or 2 days before his report, and some of our findings were mirrored at national level. And we had 334 Black people from across Greater Manchester. So thank you. And, you know, the report has received, you know, some really positive feedback up and down the country. And, you know, so we're really grateful to the community. And I keep saying we have no mandate if our community doesn't support us. So we're really grateful, you know, for the support we've had. And like Anthony, you mentioned it, you've been to a couple of our events, you've done some photo shoots for us. Anything we put on, the community comes along to it. And so the community is the real blood. They are the reason for what we do, you know, and we want to make sure we maintain that solid relationship and continue enjoying the mandate of the community.
Excellent. And I don't know, I mean, you said before about CAHN do and CAHN being a bridge, not there to do work which another agency is doing. When you say that, how many 3 years now, so you know, again, Mr. Weighty Man, you know what I mean, I'm sure you do your research, yeah. So how many organizations are there in Manchester like CAHN?
Well, if you're talking Caribbean and African related, there isn't. Even for other minority communities, there isn't a health focused, organization that is working with particular, community around health and well-being and reducing health inequalities. So up and down the country as well. I mean, today, for example, I presented to Big Society Capital, talking about our work. We have relationships in Downing Street and Cabinet Office, so up and down the country, what we do, has some real traction because it's a grassroots bottom-up approach. And we use the social movement model. So where we get communities to be in the driving seat and tell us what matters to them. So I don't know if you remember, but from our launch event, that was where we, consulted with the community and came up with the 5 health programs that we focus on. So we are very keen to keep having our community in the lead.
Okay, excellent. So can I just ask, with Sandy, I know again the languages, you're doing the language, and that breaks down the barriers, obviously bringing people, getting them more involved in awareness about how to take care. I think I've muted you there. Sorry, hold on. Sorry, go ahead, Sandy.
Yeah, okay, thank you. Yeah, in terms of languages, yeah, we do use language to break barriers. Because when it comes to important information related to health, unfortunately, sometimes with this community, I'm going to take the example of the French community. Sometimes they know that some of these health information are important to them, but they don't really grasp the message when everything is in English. I've had to hold community meetings where I'll speak just in French. Because even if they're leaders, even if they work, most of them work and they obviously use the English language. But sometimes, if the immediate gain is not there, if they go to work, they know that they need to work to survive, then the interest is there. As soon as they come out of that environment, the interest is not there, it's not really there. So you need to break down that information for them. And that's what I do during community meetings, really. We have meetings in French. I do go through some of these leaflets or other information that are not yet translated into French, and I explain everything over in French. And it's also good because a lot of them have the opportunity to ask questions in French, which again, it's a massive plus, because sometimes they do attend meetings, but because they're not very confident with their level of English, they don't really, they don't ask questions. And when we have our community meetings, then they come back to me and ask questions, or they just give me a ring, really, and say, oh, this was mentioned in a meeting. What does that mean exactly? And I'll just go over it in French.
Excellent. And again, because when we're talking in French, I suppose, I'm not trying to say that people are out there ignorant, but there's absolutely an enormous French-speaking African communities, isn't there? Because you're talking about Cameroon, Mali. Are they French-speaking as well?
Yeah.
Senegal?
Yeah, they are. Yeah, that's correct.
Yeah.
Yeah. Ivory Coast, Guinea. You have the Guinea. Well, you have 2 Guineas where one speaks Portuguese, another one speaks French. You have Burkina. You have Congo. You have 2 Congos. Congo Kinshasa, Congo Brazzaville. Yeah, we have a lot of African. And then on top of that, you also have some French speakers from France. Or from the Caribbean as well, like French islands and things like that. So yeah, the French community or the Francophone community in Manchester is massive, really.
No, I can actually, I can imagine. And the other thing with for me with language, yeah, is like I said in the beginning, I see it as a positive, as a benefit, as an extra skill. But sadly, in some situations and in some schools, and very much even when people from other countries like Caribbean spoke patois, it was seen as not subnormal. What did they call them? educationally subnormal, yeah. And there's still children that still come today and that can speak 2 to 3 languages, but they're still considered to be behind other children just because they haven't got that English to it. And I know we're in England kind of thing, and you can say, yeah, you need to learn English, but sometimes I've seen young people being made to feel that not being able to speak English, even though you can speak 4 of the languages, is there's something wrong, or you still got to work extra hard.
Well, I mean, I don't really believe in that theory. I myself, I have 2 children. It depends on how you raise them. They were both born in the UK. I've always spoken French to them. English will be their first language. They understand French very well. I'm not going to say perfectly, but they've never had any issues speaking English, or they're very good with their education. I mean, at school, and I know a lot of other families as well. Just because you speak another language, I was told, don't get me wrong, I was told when they were young, when they were starting at primary school, I was told that I need to speak just English to them, because if I speak French, it's going to be an issue. But I never believed in that. I believe that if kids, whenever they have the chance, they should be speaking at least 2 languages or 2 international languages, because as you can say, in the UK, you get to a certain level where you need, not that you need, but it will be, or it's good to have the knowledge of another language, and you don't, and then your opportunities or your job opportunities are limited. So it doesn't stop any child from performing at school. Yeah,
definitely. Thank you very much for that. Now I'm going to take a break, and then we're coming back. We're currently you listen to the search engine on Legacy, and we're currently talking to members of CAHN, the Caribbean African Health Network. We're talking to Elizabeth Alogba, Charles Kwaku-Odoi, and Sandy. Sandy, please, your surname.
Yeah, Sandy Koujou.
Koujou. I thought I was going to say that. I was. Sandy,
I know.
All members of CAHN. Listen, I've got a couple of questions here for you, which I'll take when we come back. So see you in a minute.
The vibe on Legacy. If you need professional audio at your next event, contact the Blacker Group. At the Blacker Group, we hire out all types of professional sound systems and lighting, plus single items such as speakers, mics, amps, record decks, CDJs and mixers. We also cater for all types of functions, from weddings to festivals. We can also deliver, set up and provide technical staff to manage your entire event. So, if you're looking to work with a reliable, customer-focused company with 25 years experience, contact the Blacker Group. Call us on 0161 477 9300 or online at blackergroup.com. That's BLACKA group.com.
If you have an upcoming event, a project happening, or an important announcement you'd like the community to be aware of, Legacy 90.1 FM are able to offer advertising packages tailored to meet your needs. To request an advertising pack or for further information, email advertising@legacy901.co.uk. Also, don't miss out on the key information about Legacy, so please follow the station on social networks at Legacy 90.1 FM on Facebook and Instagram, and Legacy 901 FM on Twitter. Legacy 90.1 FM. Feel.
Yes, and welcome back. You are tuned to the search engine with Anthony, and I'm currently speaking with Elizabeth, Charles, and Sandy, all members of CAHN, the Caribbean African Health Network. And you can easily find CAHN if you put in CAHN, CAHN capitals, or Caribbean African Health Network into your internet. They will come up. Same thing with Facebook. You can see what they're up to, find out how you can get involved or your questions answered around that area of health. Just a question here, guys. I don't know who wants to take it up. It says, I have not heard you mention the Afro-Caribbean mental health, and then it's got Windrush. Hello, can you hear me?
Oh, yeah,
So-
I can hear you.
So you're referring to African Caribbean Mental Health
Yeah.
Services that is based at the Windrush
Yeah,
Center.
no, I don't know if that's in relation to what I've said before with regard to they're an organization, they're not a network, so that doesn't make them similar to you, does it?
No, but we work in partnership. You know, even coming Monday, we have a joint meeting with them to get, you know, we meet in the mayor. So Chris Binns, who is the chair, you know, is someone we have conversations with, and then we went along to their board meeting early this year to, you know, Faye Bruce and I, our chair, to present, you know, about our work and explore collaboration and partnership. So I can confidently say, you know, almost all the organizations that have been around for many, many years serving the Caribbean and African community. When we started, we went along with them, just like we do culturally and have respect for our elders. We went to them, you know, try to set out what we're going to do and offer reassurance and, you know, to say we're here to complement what people do. So at the moment, I mean, ACMHS, they've been along to our collective community response meeting. They've presented about their work. We have a mental health subgroup. They are involved in that. And we have an ongoing relationship. They deal with severe and enduring mental health issues. We're able to promote their stuff. We have 2 or so of their staff members who are part of the GM-wide WhatsApp forum that was set up at the start of the pandemic. So we're very much working in relationship, you know, in partnership, and we're collaborating with, you know, various organizations that seek to serve Caribbean and African people.
And I know, because for me that's very, very important. You know, I've been around for a very long time in this community, and there's a lot of cycles that tends to go on, which kind of like saddens you as you try to grow hold gracefully in some kind of way. But then there's things that happen that actually re-energize you, and sometimes it is when new organizations come around and you see people coming together, especially when you see young people start joining. But we hope, like you said, with the respect for the elders, that these new organizations do seek to stand on the shoulders of the people who've gone before, and not necessarily break down sometimes what they've achieved. And you know, we don't have, as a Black community, I think the greatest relationship or historical relationship with this council, yeah, or with people in positions of power, that the police or whatever. And I'm not saying it shouldn't happen, because obviously we work with these people, we pay taxes, and there's things that are happening. But what for me seems to be has been an issue sometimes is that collective, whether it's the collective challenge, whether it's the collective meeting where there's an actual one body. Not to say everybody has to be together, but that that you are actually dealing with a structure. Because what we've actually had in the past is what I would say is divide and conquer, or divide and rule, or, you know, when you get one person, take me to your leader, and this person speaks for everybody, and it's not exactly the case.
Yeah, I think for us, we, you know, as CAHN, we're really clear about, you know, the things we agree to and the conversations we have. You know, it's really important that we have fantastic relationships with civic structures, and, you know, so whether it's the police, whether it's local authority and others, because, you know, the sad truth is, if you're not in the room, decisions will be made for you, you know, because there are people in positions of power who have legal obligations, they have political obligation to be able to deliver for local residents.
Yeah.
So what we're very clear about, and that's why in our mission we talk about leading some of those strategic engagement. So we have been able to find a way where we can say, our community, for example, doesn't trust you guys, that when you come out with a vaccine, you have their best interest at heart. But then we don't just hit people with a stick and leave them, or leave them to do the thinking. What we offer them is, let's co-design a solution. Let's look at how we rebuild trust. Let's look at how we begin to address some of those issues. You know, so that is what we really clear about, and we clear with the community. So we've held, at the start of Black Lives Matter solidarity protest, we convened some meetings where we had the police there, we had local authority leads there, and we were having some robust conversations following the shootings, in Moorside in July. We called some community meeting. We convened that. There were heated conversations in the room, but we were able to bring those civic and political leaders along to those meetings in less than 24 hours because of the relationships we have. So we're very clear, we will not destroy the relationships with those who have been voted. And I think sometimes, it's also important that we realize and recognize the framework within which some of these politicians have to make decisions, because resources are tight. And so what we keep saying and what we keep pushing for is, let us be part of the process where you arrive at your decision making, if it's to do with resources, so that we can have a high level of confidence that we can go back to our community saying, well, there was only 100,000 for the whole of Greater Manchester, but only 20,000 could come to the Black community, and we were part of that transparent decision making. And that's what we've been pushing for. When we had Andy Burnham on 2 occasions, our mayor, come on the collective community response meeting, one person who served for many, many years in the police, he quizzed him. He said, if Black lives matter to you, really, you would have had some senior Black people in your office, or in your administration, and you've been around for 3 years, so there are some positive, healthy challenges. I think for us, we're mindful about the language that we use when we
Just one more quick question that came in, which you nearly touched on, which 274 says, do you see recent deaths in the community as a health issue?
Well, I mean, obviously, we've said on record, whether it's Faye or myself on Sky News, on BBC, on ITV, that COVID-19 hasn't taught us anything new. Before the start of the pandemic this year, for our International Women's Day, we focused on maternal mortality. And that is data that tells us that Black women are 5 times more likely to die during childbirth. And if you look at the COVID-19 rates, the high is about 4.6 or 4.8 thereabout. So the issue we've been grappling with for many, many years, it's even worse than what COVID has brought. So COVID has just shown a light, and we've known about this health.
We'll just quickly go on to COVID, but I think this person's relating to the deaths actually of the young people.
Well, I mean, the health inequalities is the same. I mean, we were running a program called Healthy Hearts, where we were, having dedicated workshops, and would have a pharmacist, a nutritionist, physical instructor, and a nutritionist, or a cardiologist do kind of presentation. And then we had Black nurses, thankfully, given their time to do health screening. The youngest we had to refer to a GP was a 15-year-old. Who was fit. He was in church. Did that screening happen in a church? But his readings were concerning for the nurses. They did it 2-3 times, and it was still concerning, referred to the GP. So, health inequality. We know prostate cancer, for example, will affect our Black men a lot earlier than the majority population. So the health inequalities we are aware of, and that is why on Tuesdays, for example, we keep a focus on nutrition and physical activity, because anyone can go at any time, and the health inequalities are with us, and we got to deal with that.
Okay, I just got another text in saying about Cathlock Centre needs urgent attention, their mental health service. That's not your role, is it? You don't. I don't know.
No. Obviously, no. We don't. We don't oversee services. We run our own. We try and collaborate with others, and we make sure what we offering is complementing others. So, for example, our counseling service will focus on bereavement support. We will do victims of domestic violence, and then low-level mental health stuff. So, we're more than happy to support and work with others who are having struggles, because, I am on the VCSE mental health leadership group, and happy to take some of these issues
Yeah.
happen. So,
But I'm going to
yeah,
speak. I am going to speak to you about the DSV, the domestic and so sexual violence, and you and Sandy. So let me just go back over to Elizabeth, because I haven't spoken to Elizabeth for a while. So Elizabeth, so all this that the guys, I don't know, you're gonna have to mute yourself, Elizabeth.
Hi.
Yeah, so what the guys have been talking about, you've obviously got the task of making sure this gets out there to people, and I'm sure that probably sometimes there's mischievous people like myself that want to get in touch with you and ask you questions, or even want to maybe use your platform and stuff like that. So how do you balance that in making sure obviously it's clear as to what your role is as CAHN, and it's not, the people don't get the wrong idea?
Okay, yeah. So in terms of that, we as CAHN, we have a lot of different services that we offer, a lot of different projects that we're working on. And that's why my role is very vital in terms of the comms and the language that we put out there. Like you mentioned, we have to be clear and we have to make it simple as well for people to understand. So that's why in terms of the communication side of things, in how we phrase certain messages. Perfect example, organ donation week is coming up next week.
Okay.
Or around organ donation has actually changed during COVID. So pre-COVID, we were already pushing out different messaging around, engaging with people to, register to our organ donation list. But then obviously when the law changed, we had to re-strategize, we had to change the messaging. There's certain types of language and stuff that you can't use as you did before, because now it's up to the person as an individual, option to them wanting to give. So we had to change that, and it bottles down to it again, in terms of languaging. We have to make sure, we are putting across our view as CAHN, but at the same time, like Charles mentioned, we're here to complement. We're not here to take over anyone else. We will support where we can, but at the same time, we always make sure our stance as well is correct. So messaging has to be 100 before.
Is that sorry? And I don't know if you actually can answer this, Elizabeth, because are you getting that? I mean, I don't know if even a platform is the place to have this conversation, but when you talk about we're here to do what we do, we're not here to take over anybody, do you get that feeling that other people actually feel that?
Good question. I think I'm
taking that there, yes.
I have my own personal opinion. I think I don't even know how to phrase this.
Your boss is above you there, so
yeah.
Well, no, I mean, share your thoughts, Elizabeth. But I mean, it's fair to say when you're an organization, working across GM and some of the national attention we get, then there's the possibility of others feeling a bit threatened. So it's important that we kind of reassure people. There are different lengths, and everyone has a role to play. So yes, there are times it comes across like that, and of course, I mean, for me personally, I have a responsibility to make sure that there's a staff team to deliver on the work they have to do. So we got to fundraise. Yes, there will be times we would have to put in those competitive bids, and then I need to make sure there's resource in there. So there will be times when we all trying to get a slice of the cake, and that's fine.
Yeah, it's friendly. It's friendly. How do they say? Friendly competition. There's no harm in that. And it comes down to the benefit of CAHN at the end of the day. We as an organization, we're really big on, like we mentioned before, collaboration. If there's another service, we have different mental health and different counseling services that we offer. If there's another service or another organization that offering the same exact service, we would more or less come from the approach of, oh, how can we help you and support you to advertise your project or your service? We wouldn't come from, oh, let's set up another service to come, to do that. So we're more or less coming from that type of approach. But it's friendly competition.
Yeah, thank you very much for that. And also, I'm sure, you're here. I'm finding you all quite pleasing. I'm not, you're not scary in that. So I'm sure you will give out that message to say if anybody does feel that way or have any, Chinese whispers or information that they've got secondhand, then they can come direct to Charles or whoever at CAHN and say whatever they want to say. I know, Charles, you're not a fragile man. If somebody comes and tells you something, you're not going to boo-hoo and bow down and whatever. You'll give them and let them know exactly how you feel. Am I not right?
Well, yeah, and it's worth also saying that for most of us, we have our own personal values. I lead the church. I have Christian principles and values, and I believe there are many fishes in the sea, and we don't feel threatened by anyone at all. So equally, no one should feel threatened by us. We will celebrate, if it's a little finger or the thumb or the middle one, or the one with the wedding ring, that's fine.
Yeah.
We need all that to be complete. And so, yes, our encouragement as a community, and that's why we're so grateful that, people from our community responded when we put out the survey. Currently, there's a scoping that we started before Christmas, which we had to put on hold, in light of COVID. We want to create a directory of services for Caribbean and African people right across Greater Manchester. So we put in the hard work, we find the resource, and we're saying it's for the community. So whatever we do needs to have the community at the heart of it. It has to be benefiting our community because our people responded to the survey up and down the country. It is the only primary research of Black people. It is the only thing that has captured the voices of Black people in an authentic way. So we're here for you, community. We are with you.
And just on that report there, Charles, where can people get to see that?
It's on our website.
It's on your website.
Yeah.
Thank you, communication. And let me go over, because again, this time it goes really, really quickly, and I think it's very important that I want to speak with Sandy with regard to the lead project, the domestic and sexual violence, because there has been a rise in that, hasn't there, since this since COVID and people having to find out to live together. And I don't know if it's just about that, but so what have you been finding? And just tell us a bit about the project and what it does, please.
Yeah, thank you, Anthony. So I'm glad we're talking about the project because when we started the project, I was delighted because it's a topic close to my heart. I have to say that it's not an issue that started with COVID, although we know that the numbers have grown during COVID. Unfortunately, because, you find couples relationships where it wasn't going, too great, and then they find themselves confined in a house, in four walls, and, what happens. What we offer at CAHN, it's a confidential helpline. So the helpline is open 7 days a week from 9 a.m. till 10 p.m. And it's amazing because, unfortunately, in our community, we know, I know, again, from statistics that cases have risen. Unfortunately, there is, in the Black community, you have the cultural impact that, how can I say, makes people not want to come out about it. Because I've spoken to people who were going through DV, that the husband is pointing the knife at them, but they're just afraid to come out because they're afraid of what the community will say. So yeah, that's a massive challenge. But again, at CAHN, what we do not offer a holistic service, but we do raise awareness on the issue because we know it's a massive issue in our communities. Unfortunately, yeah, it's a massive issue on our community. We do raise events. We do raise this awareness via events that we organize online. With Elizabeth, we're planning to organize some live events, sorry, on Instagram and Facebook. So please look out for it on our Instagram and Facebook. We'll be having some live events soon. What we do as well with this DV program is to encourage men to come forward. Unfortunately, Black men do also suffer from domestic violence. They don't speak so much about it. It might not be physical violence, but it's still violence. You have all sorts of domestic violence. You have emotional, psychological, financial. It's not just, violence. It's not because someone has laid his hands on you. No. So we know that men suffer from domestic violence, but they're very quiet about it. And we're hoping to have men coming out, speaking about it, and hopefully, get some help, because as Charles mentioned, we have counselors, and these counselors can offer one-to-one support, and that is therapy for anyone coming out of a DV issue, that is domestic violence and sexual violence as well. And we also work with another organization to offer practical advice. So we work with this organization called Olive Pathway. Olive Pathway help anyone coming from DV with legal advice, financial support, immigration. I mean, anything you can imagine, anything practical you can imagine. So it's important people understand that help is available, because unfortunately, sometimes people are afraid, especially with women who are dependent on their husband, who is the only, who is the only one who works at home, and they're afraid that the financial help may disappear or something like that. It's important they understand that help is available. So yeah, we also signpost to other relevant services if we believe that a case is an emergency case, because this is not an emergency service. Any emergency service obviously will have to signpost the person, or refer the person to the police or the relevant department or or service, really. And we also offer language services. So if anyone comes and if they speak French, for example, we offer translation services or interpreting services. It's the same with Portuguese. We offer Portuguese services for anyone coming from that community. So yeah, in a nutshell, that's it. The only thing I need to add as well is that the services are culturally appropriate, because sometimes a person suffering from domestic violence, if let's say the issue from the issue in your relationship was in Africa you have something you call the bride price. Sometimes when the man has paid some money, to get married to you, he feels as if he owns you. So when you're going to mainstream services where they're not used to these kind of issues, they struggle to understand you. They struggle to understand what the issue is really. And because they're struggling, because of that cultural misunderstanding, they can miss the point. And for you as the victim, it doesn't make it easy, really. So our counselors, as Charles mentioned, are Black counselors from the African and Caribbean community. The other organization, charity we work with, it's also African Caribbean, so they understand that cultural impact, which makes it easier, to be honest, for victims, because they feel, they feel that someone can really understand them. They're not just speaking to the wall or something. So yeah, that's it, Anthony.
No, that's very, very important, and it's something I know that people have been fighting for a long time, that cultural appropriateness, and also obviously that and that area of DV, it's got so many layers, hasn't it, in how people can be affected by it, and I suppose there'll be people that are quite also refreshed to hear you refer that also to males, because I think it's something that, like you say, a lot of women don't want to talk about it, but men are not brought up, or should I say molded, to speak about something like that. That's would have been seen as something of embarrassment rather than something to talk out about. So thank you very much for that, Sandy. That's needed. Just some of the other things, Charles. I'm back to you with what you feel needs to be expressed in the time that we've got left here. There's a few things, other projects that you're overseeing. CASO, what's CASO?
Yeah, so CASO is knowledge access screening opportunities, and that builds on our Healthy Hearts program. So it was a one-year innovation funding from Salford CCG, and so that's targeted at people living in Salford. And basically what it is as an organization, we're seeking to raise awareness of cardiovascular diseases, and how that impacts on the Black community. And the view was to develop resources in English and French. So we would come up with leaflets and stuff. But what that is offered us is a way in, and we're working closely with Salford CCG. So during this pandemic, Sandy and I, we've been part of various meetings and trying to offer support and some engagement with the Black community.
Okay then. So I mean, you might have mentioned this before, but I think I probably need to revisit it, even if I have. What's some of the main things, with regard to this time that's happening right now with COVID, people being in lockdown, whether it's masks, visors, washed hands, food, vitamins, and whatever. What is the main kind of like caveat, strapline that CAHN are saying is really important for the African Caribbean community to fully be aware of right now? I'm going to give you a little time to think about that, because we're going to go to an ad and then we'll be right back. Okay.
The vibe on Legacy.
If you have an upcoming event, a project happening, or an important announcement you'd like the community to be aware of, Legacy 90.1 FM are able to offer advertising packages tailored to meet your needs. To request an advertising pack or for further information, email advertising@legacy901.co.uk. Also, don't miss out on the key information about Legacy, so please follow the station on social networks at Legacy 90.1 FM on Facebook and Instagram, and Legacy 901 FM on Twitter. Legacy 90.1 FM. Feel the vibe.
Island Vibe Bar and Restaurant, giving you a taste of the Caribbean. Join us at Island Vibe in Cheltenham for the perfect authentic Caribbean meal with a true island feel, sweet reggae music, and our wide selection of rum cocktails and wines. Island Vibe is the perfect spot for any occasion. Visit us for brunch, lunch, or dinner from 12 p.m. to midnight weekdays, and enjoy late nights and live music on the weekends. Vegan and vegetarian options available. Island Vibe for the perfect authentic Caribbean meal. 414-416 Wilbraham Road, Chiltern, Manchester, M210SD. Call 0161 282 6061 to book now, or book online at www.islandvibebarandrestaurant.com.
Blacker Group is one of the UK's leading sound, lighting, audio-visual and stage installation companies. Our sound, lighting, AV and stage installations can be found at venues ranging from exclusive restaurants to government institutions and corporate facilities. At Blacker Group, we offer an unrivaled level of service. Our experienced engineers only use the very best equipment tailored to your specific needs, and the service the maintenance team are on hand just in case anything goes wrong. So, if you're considering a new installation or
Yes, welcome back. You're entering to the search engine with Anthony, currently speaking with members of CAHN. We've got Elizabeth Alogba, Charles Kwaku-Odoi, and Sandy Koujou. Yeah? Okay, we'll go with that. Okay, but I had a question before we went to the break. Can you remember it? Do I have to go over again?
Yeah. So during these times, our message to the Black community is clear. COVID is real. So lots of myths out there. It's real. When Black people get it, our outcomes are worse, and we end up having the worst, one of the worst fatality rates. So it's real. Listen to the public health messaging. So whether it's about washing your hands, keeping yourself safe, know your condition. Know how much risk, or the risk level, especially if you're someone with some of the underlying health conditions that were mentioned at the start of the pandemic. So whether heart conditions and other cardiovascular related conditions, then it means if you contract COVID, sadly, your outcomes will be worse. So COVID is here, is with us. Follow the public health messaging. We know it's not always been easy read. We know our mayor, for example, has been challenging government. So, some of the boroughs in Greater Manchester have been in and out of lockdown, or government will say we out of lock, and Andy Benham will say no, stay indoors, and then government does a U-turn. But COVID is real. During these times, right from the start of the pandemic, what we've been doing are holding information sessions. So, for example, we've organized 2 sessions about safely reopening churches. We've had, the first instance about 24 church leaders, the second one about 35 thereabout, with public health officials, just going through how churches can reopen safely. We've had those sessions on Tuesdays. We've been having healthy hearts, so talking about nutrition and physical activity and why it's important. So even if you don't go anywhere, you can still exercise in your home. And then on Saturday mornings, we've been having health hour, and since the beginning of May, every single Saturday we have senior Black consultants, whether in emergency medicine, gynecology, ENT. Coming Sunday, for example, someone, who is a kidney specialist coming to take that session, so
Can
it's
I just
important.
ask you, just with regard to, because I think you're right, and it's very important that people follow what's being said. My question has been not with the COVID, that is whether it's real or not. I kind of wrote this thing down before, saying I think there's different levels of the response. I ain't saying I'm doctor, but in the sense of food and health as a first step. And what I get, and I believe that is not being done by a lot of people who are giving advice. They're talking about the washing hands, the masks, and everything else. But I think there should always be a caveat before that with regard to your healthy foods, your greens. Yeah, that's the foods that you get the vitamins from, and then secondary the vitamins and minerals themselves. So there's this prevention, but I never hear that really coming, not on the media and whatever. Do you hear that, or am I saying something that is wrong here?
Well, that is a given. We've been talking about the food wheel in CAHN, and also government has launched a better health campaign. I gave a quote alongside Professor Kevin Fenton about the need for us to look at what we eat. So that we've been talking about. We have a nutritionist who comes along with colleagues on Tuesday evening talking about nutrition. So it's a big thing. It's a given. As CAHN, during the pandemic, what we realized was, people missing out on their ethnic foods. So what we did was to find pots of, money and buy some of those ethnic foods in bulk. But I think, when we talk about our food, it's a massive piece of work that needs to happen, and lots of education about the greens. On Saturday, for example, the one who took the health hour was focused on, talking about the greens and why we should eat raw stuff. So our diet is important, but what is not easy to do is during the pandemic for you to want people suddenly to change their diet. you will put people off. So it's about how we able gently to get in the messaging about, your diet, what you eat, physical activity, as well as making sure that the public health message, people are following those guidance.
Yeah, I hear that. I agree with for the most part, but I think for me it's like that. I don't know, the food and the things, that prevention, But I hear what you're saying, Charles, and I do agree. But I was talking to an actual physician the other day, and I actually said the same thing to him, and he said it's only really recently that the actual whole health system started looking at foods and vitamins in that kind of preventative way, because it's not really necessarily in the interest of so many of these pharmaceutical companies to prevent.
Well, I think health is more than medication, and the prevention has always been there. I think for us, some of the BAME or Black-led organizations, what we keep talking about are culturally and religiously appropriate services, targeted, tailored information that our communities could understand. So, like Sandy mentioned earlier on, when people are in the work environment, they will respond, they will do stuff because they know they're being paid. But the moment they're out from there, so having targeted nutrition, information. So the food wheel, for example, the 5 a day, if someone asks you 5 a day, what will it be from the Caribbean or African community? We don't know, because not much work has been done about it. But also there's a big piece of work that needs to happen when it comes to the salt levels and fat levels within our own foods that we eat. So the prevention stuff is a big thing, and many people up and down the country are pushing for our NHS to be more about preventing ill health rather than treating ill health.
Okay, excellent. Listen, we've literally got about 4 minutes to go before we've got to go. Yeah. So thank you very much for joining us. And if I could just get some last words from all of you in relation to your area and what is important within that area at this moment that you just want people to know about. I'll start with Sandy, because Sandy was the first one to join me today on the show. So go ahead, Sandy.
Okay. Yeah, Anthony, what an honor. Thank you. Well, the last thing I can say really is that I know that during this COVID period, people have been going through a lot. So in terms of DV, it's important, people, we have free counselors for free therapy. We know that how going via the NHS, it can take months for you to be able to see a therapist. So please, everyone, if you're going through any sort of stress, whether it's DV related or not DV related, you don't need to have a mental health issue. Please just contact us and you can have a free counseling service. Thank you.
Okay, thank you very much for that, Sandy. Can I go over to you, Elizabeth?
Hi. Yeah, I think for me, it would just be more of how you can get a hold of us at CAHN, just making sure to follow us on all of our social platforms. If you'd like to attend any of our activities that we hold during the week, as Charles has mentioned, on Tuesdays, we have our Healthy Hearts activity sessions. So that's a physical activity followed by a nutritionist section. That's 6:30 to 7:30 on Tuesdays. And then followed by on Saturdays, we have our health hour, which is 11 a.m. to 12 p.m.
Exercising,
and then
it?
fortnight.
Is it you that's doing it? Are you taking it?
It is. No, I facilitate the section, but I actually don't do the physical exercise section. No. One of our volunteers, Doretta, and she does a great job. And then on fortnightly Fridays, we have our collective community response meeting, and that's between 1 till 3. So we'll put the details as well. And then we also have our Black History Month. Black History Month is next month. This this month into next month. We have
what
our
have you got
event
going
at
on?
the ending of this month, so definitely.
What's going to be happening
Don't
there?
worry, I'll just say watch this space.
Okay.
That'll be fun. I mean, it's
Yeah.
watch this space. Watch. Don't give away too much.
And how are you actually? Because obviously you've got this COVID thing, and you was involved obviously with your online stuff before the lockdown, but it's obviously increased now, not just with putting out publicity and stuff, but in actually setting up these events online. Just very quickly, how much has that really changed, or is it better for you because you can do it from your armchair having to run around to different venues?
I'm not gonna lie, for me personally, I prefer physical events, getting to someone face to face. We have had to adapt online just because of the current situation. But I find it's equally beneficial because a lot of our community do like to engage with our events. For instance, we had our Windrush event, first ever virtual, and that the response was just amazing. But I found some of our people don't actually have some of these technical devices, so it is kind of hard trying to engage with them because some don't know how to use it. Take for instance my mom, I have to teach her some things because she doesn't know how to use it. But we find hopefully as some we will like to have physical events, but with the current situation it's going to have to be virtual for now.
Excellent, thank you. And last but by no means least, Charles.
Well, Anthony, really grateful for your support, and obviously you're a brother to, Lorna, who is one of our directors. A big shout out to all the.
Did she tell you that she's my sister?
A big shout out to.
Thank you.
To all the CAHN directors who have given so much, since we launched, back in 2017, right from the start, to the launch event. Really, really grateful. Once again, I can't thank the staff team enough. The team is grown, and that's fantastic, and they're doing some amazing work and giving so much time over and above. To our wonderful volunteers who, I remember we put out an advert saying we want just techie savvy people, and some came back saying, no, I want to give something. So we're grateful to the volunteers, to the medical consultants, the black ones who give their time every Saturday, engaging with our community, offering free consultation, not charging anything. We're really grateful. And then obviously, thank you to the community for the support we get from you, responding to the surveys. And to all our funders, without your money, we couldn't have done what we've done. And so thank you that, we're in quite a secured place for the next couple of months. But we will continue to knock on those doors. And to all the partners, and those who support in kind, we're really grateful.
Okay, man. Thank you very much. So thank you, Charles. Thank you, Elizabeth. Thank you, Sandy. I don't know if I've met you before, but I'm sure I will meet you at some time. It's been a pleasure. Thank you very much. You take care.
You.
And that's it for me this evening on the search engine, speaking with CAHN. And we'll be back next week. Next week, we will be speaking with TAP. It's going to be a TAP talk show. We haven't done that for a while. So please make sure you get involved as usual. Coming up next, Ben Thursdays with Tapper Benz and Dolphin. You know how they do it. Stay tuned. See ya. Bye.